So these are the 5 images that you would have done in your imaging session. You are obviously undressed just from the waist up. The camera is usually a couple feet away. Everything's with arms up so we can see all angles of the breast. It takes about a week or so to get the results back. If there is a major concern, we would send that urgently and we'd have that back within a 24-hour period. They're pretty detailed in their reporting, which is very nice. Usually it's in terms kind of all of us can understand. Otherwise, we always have the provider look over it and just make sure that we don't need to order anything right away. This is kind of what a normal breast will look like on a thermogram. This is where there's inflammation, breast cancer in that breast. So you can definitely see the one side to the other of how different that is. Estrogen dominance, a lot of inflammation almost throughout that whole chest area. They'll show you immune dysfunction, which looks kind of in their back area too. Male breast cancer, so you can definitely see all the inflammation and then how cool it is in that breast as well. And then there's some shoulder pain and that sort of thing, just so you can kind of see those differences within the images. Again, they kind of have normal breast to abnormal. Normal symmetries of healthy breasts. So you can basically, you want that image to look similar from one side to the other. When there's differences in that image, that's where usually there's a concern. This is like thermography versus ultrasound. So looking at this area here and then confirming with an ultrasound of that spot found with the thermography. Again, they're kind of the same. Inflammation with the right breast, ductal carcinoma, which can be pretty invasive too, which can be hard to find in other testing when it is ductal cancer. So you can actually see that it stands out pretty good on this thermography. And this one shows those fibrocystic changes in the left breast. They show some heart disease, pre-stroke, where there's all that inflammation in the neck there too. Carpal tunnel, dental stuff. This just kind of shows cell growth for tumors. So thermography can catch it at the 2-year mark when you have about 256 cells. That would be a cancer cell, where mammograms waiting till almost the 7-year mark. So those cells have been growing for that amount of time before it's detectable. With thermography, there's no radiation. It's hands-free, nothing touches you, there's no pain. And then early detection saves lives.